Well, it seems every time you turn the television on, you're seeing something on the news about substance abuse. And before it gets to that point, it's important to recognize the issue, right? So we have Antoine Taylor with us from Gulfport Behavioral Health System. How are you?
I'm doing well. How are you?
I'm well. Thanks for joining us. Tell us a little bit about how you treat folks who may have a substance abuse issue.
Oh, for sure. So you should treat someone with a substance abuse issue with kindness and understanding. It is something that they did not ask for. They kind of fell into it. Sometimes it's with a friend and just out of boredom may like, hey, I have some marijuana, let's try it. And from marijuana, substance abuse can grow to more extreme drugs.
Right, and listen, I hear a lot of stories from folks who are in my circle of friends who were prescribed a medication for a very specific reason that they couldn't seem to get away from, and then that could also spiral out of control.
Oh, for sure. So most times is unintentional, and then it can lead to embarrassment where someone does not want to reach out for help. It's up to some family members to tap someone on the shoulder and say, hey, this is spiraled out of control, let us get you some help. And then that person has to be willing to accept the help.
What are some of those things that family members might notice from their loved one to be able to recognize the fact that there's a problem?
Yes, so a change in behavior. You may see someone hiding more, being more reclusive. Their outside appearance may be changing. One person may have a full set of teeth. Next thing you know, their teeth are missing. Face sores. Just nervousness, not trying to work or be productive in life.
Well, and it goes without saying, the risk factors are great. Like the very extreme, you could lose your life, but those risk factors are also something you want to be looking for.
Oh yes, I'll definitely look out for risk factors because again, the extreme is losing a loved one. Sometimes it can be with being arrested. Legal issues. So it goes from misdemeanor to felony real quick.
Awesome. Thank you, Antoine.
All right, thank you.
We're joined now by Susan Beaudoin, who works for Gulfport Behavioral Health System. Let's talk a little bit about the quality, or let's talk about patient care, safety of patient care.
Okay. As the director of nursing, patient safety is our #1 priority from the time that they walk through our doors to the time that we walk them out. It's crucial to healthcare that we keep our patients and we keep our staff safe.
And I feel like that is a good rule of thumb for every clinical space. Yes. Specifically here, though, that is most important here because in spaces like this, the last thing you want to do is hurt the patient.
Exactly.
Whether that's, you don't want to hurt the patient physically, but like mentally, emotionally, that's a big problem to have, especially in a space like this. Speak a little bit about that.
Yeah, so, we encounter our patients and usually they are having the worst day of their life, the worst week, the worst month. So knowing that, we have to have a lot of compassion and we have to have that encouragement for our patients because we don't know what they're going through. So as simple as, a smile or, tell me what's going on. Just to be there with them and to notice when things are starting to escalate and intervening is absolutely something that we have to do.
Yeah, and that's kind of like saying every interaction matters. Even the smallest, even like saying hello or smiling could change everything.
Absolutely.
Yeah, and so whenever patients walk in the door, that's the exact kind of treatment that they're going to get, right?
Absolutely.
Every single time.
From the time they walk in to the time we walk them out.
How do you begin to recognize when a person walks through the door? Like, what are some of the things that you see when you're like, they need immediate assistance?
Anything with showings of anxiety, they could be nervous, shaking, pacing back and forth. They could, aggression comes out a lot as different emotions. So they could be upset, they could be angry, they could be sad, and it comes out as aggression.
Right, compassion is a big piece of it. Encouragement also is a huge part of it. That is like one of the first few steps to recovery, right? You've got to be encouraging. Tell us a bit about how you guys do that here.
So, mental health is everywhere. And one of the things that we try to push for is we are the first step to a healing process. So when our patients, when we're with them and we're working with them, we're encouraging them, we're pushing them, you got this, you got it, just, a little bit more, do a little bit this, and then we give them the coping skills and the tools that they need so when they do leave, that they'll be successful.
Yeah, that encouragement is a very important piece to it. It could make or break the situations that you have here.
Yes.
Awesome. Thanks, Susan.
All right, thank you so much.
I'm joined now by Monet Keys, who's kind of working in the outpatient program. Tell us a little bit about the therapeutic recreation that you offer here.
Yes, so within the facility we have an abundant amount of recreational activities. We have what's called leisure education, and that's going to be things like we are teaching them coping skills, we're teaching them how to build their self-confidence, and we're also, if they're having any sort of isolation or any feelings like that, we help them reduce those feelings as well. We also offer pet therapy, and that's a client favorite, and it just really just brings the clients joy and laughter and happiness overall.
I think that is key in every kind of therapy, right? In any therapeutic situation, helping patients without patients realizing they're being helped.
Yes.
I think that's key. And again, we're in the South, right?
Yes.
Our pets are part of our family. And when you're in clinical environments like this, a lot of times those pieces of home that make you feel a little more grounded, those are missing.
Yes.
And so tell us a little bit about what the pet therapy does for the patients here.
So the pet therapy basically just lets them let go of anything that they're facing, and they can kind of be in that moment. I think a lot of clients come in and, like Susan was saying, they're experiencing the worst times of their lives. So being able to just let go and be in that moment, see cute little pets, it just makes everyone happy.
And you guys work with meditation practices here as well.
Yes, we do. We have yoga that's offered and meditation as well. And with that, it really just provides the clients a sense of calmness, and they're able to ground themselves in that moment.
Also, I think what's key is that you're providing them the support
Yes.
that they need to get better.
Yes, for sure.
And that's key.
Yes, it is.
Whenever you feel like you're being supported in that process of healing, and you can find that healing yourself, that's whenever it really becomes part of that recovery.
Yes.
Awesome. What have we left out? Yoga, pet therapy. Yoga is a big one. I've just recently found yoga myself.
Yes.
And there's something to yoga. Speak a little about the yoga that you offer here.
So we have someone who comes in and does yoga. Like I said, look, yoga is something that's very, very hard sometimes, but it helps them with breathing techniques. It helps them kind of figure out how to ground themselves, and grounding themselves is basically being in that moment, kind of taking advantage of everything that they're feeling and letting go of kind of what they're thinking in that moment.
Sure, grounding and then reconnecting with yourself.
Yes, for sure.
Big piece of that.
Yes.
Right, so you see that information there at the bottom of your screen. You see the phone number, you see the website. Reach out to the folks here at Gulfport Behavioral Health System, even if you don't think that you need help. But if you feel there's a little something happening there that you want to be seen about, give them a call. They can help you out. Thanks, Monet.
Thank you.